looking for health and safety agenda. What is the trends that you are seeing and how you can imagine the future of health and safety? So the trends is for this moment and the future.
Okay, the big trends at the moment that we're going through, right, is still a process of simplification of many of our requirements, right, from a top-down point of view. And we're also digitalizing, right? But we have a rule on that. The rule is simple. If it gives time back to my EHS professionals or it gives time back to managers, then we look at it. If when we look, so we don't digitalize for the sake of digitalization, right? So for example, I haven't bought a software platform for L'Oreal worldwide. I don't have one, right? Not one that's been bought externally. However, I have certain tools like safety improvement opportunities, which is like people, when they see something as an opportunity or a hazard, right, they have a system for reporting it and it goes to the manager, because for visible felt leadership, only the manager can resolve an action identified by his team. You can't delegate it to EHS or HR. It's the manager of visible felt leadership. He has to resolve it. And each manager has an objective of 90% resolution of his what we call safety improvement opportunities. So we're focusing on being more efficient with what we've got. We're focusing on the leadership more and more. We've had a big focus on leadership, but the leadership, for me, leadership drives health and safety, right? And it has to be it's not only about saying we need to lead, that leadership needs to be visible and felt. So that's why we talk about visible felt leadership, right? It's not just saying, oh, well, I'm really, really good, and you're preaching to yourself and all the rest of it. You people have got to feel it, right? And we design our programs to sort of do that. So I think at the moment we're simplification, getting better at using the things and the tools that we have. We're still struggling from what happened in COVID. A lot of companies, even though many won't admit it, went off the rails during COVID for health and for safety. Most of the health and safety professionals, rightfully so, were focusing on COVID, protecting their employees and all the rest of it. A lot of the safety tools, the safety methodologies that were in place were let go. The problem was a lot of the facilities see the performance improved, yet they were doing less on the ground safety, right? Maybe less people were at work. Putting some of our sites back onto the rails with respect to our methods and our tools is a little bit of challenge. The other challenge that we've had and that we're really dealing with at the moment is some of our tools, like our Visible Felt Leadership Program that's called Measure, has been in place since 2010. SIOs, the Safety Improvement Opportunities, 2011. And even today, between the two of them, we get about 75,000 action items, 90% to 93% resolved per year. So it's still going well, except for people had lost the sense of why the tool. What was the purpose of the tool? So what we've embarked on over the last 3 years is also on key sites doing what we call sense of purpose. So we go in and we talk about the sense of purpose of why safety, why health, and also the sense of purpose of the tool, the way it was designed, why it is the right tool at the right time, just to put them a little bit back on track, and it's working well. So that's what we're focusing on at the moment, is making sure, and I know a lot of other companies are seeing this, is a deterioration, whether it be in culture, performance, however they measure it, whatever. What we're trying to do in L'Oreal before we go too far into the future is secure that. So we stop the degradation, the rot, and we put our sites on track to make sure that we don't lose somebody. Because one of the problems that I see with a lot of professionals at the moment, and I will not allow it to happen in L'Oreal, is because we're trying to do so much now, and there's so much pressure coming from many areas, right? I'm going to say also many ideas of how safety should be done, right? The EHS professional are taking their eye away from those low probability catastrophic events that kill people, right? They're dealing with because they've only got, they're great people, but they only have 24 hours in a day, right? So they have to let go something. I'm not allowing that to happen in L'Oreal, because I would rather have 5 or 6 or 10 or 20 minor accidents, right? than one death. So I have to make sure that that is secure and that remains in L'Oreal right now. So that's where we are at the moment. Looking to the future, you're probably expecting me to say AI, and I'm going to say not really. We've looked into it a lot, and I'll tell you why. One of the is that there's a lot of resistance from employees, right? When you put it into the sites, whatever, and I can understand, right? I think it'll change over the next 5-10 years, etc. And in some countries, actually having cameras that are watching you 24 hours a day is norm, right? So it depends on culture. However, what we are using AI for and trying to develop it within the EHS professionals is to enhance the individual capabilities, make them more effective and efficient by using AI as a tool, as an assistant to them, right? So it's the human element plus the AI together that can enhance, I'm going to use the word enhance, an EHS professional, down to doing something simple like using AI to create a simple training video, or using an avatar that's AI to do some training, or using a PowerPoint presentation platform that has AI in it in order to do nice, superb, and how can we be more efficient? Recently, somebody in my team, he did an audit. He uploaded an old audit into ChatGPT or the L'Oreal version. He put in his notes that he did from the audit and said, write me a report. And in 2 minutes, ChatGPT wrote his audit report, which would normally take him 4 to 5 hours. And so that's what the future on the AI side, where we're working within L'Oreal. We're also having a focus on upskilling our EHS professionals in leadership and mentoring skills. To be honest with you, as I said before, I think a lot of them have good leadership skills already. Unfortunately, a lot of people outside of our profession don't realize that. They're seen as being experts that you can put in a drawer. And one of the things that we're doing now is we don't talk about EHS experts, health and safety experts. We talk about health and safety professionals or health and safety leaders. When I have my senior network together, it's the Senior Health and Safety Leadership Network. Okay. It's changing the narrative in some respects, changing the story. So there's a big focus on that. And I also think we're going to see more and more, or doing this at the moment is reviewing, is there any value of some of the stuff that's out there, like HOP, right? We're looking at, is there something in that we've got missed? Because it's like with things like, whether you talk about safety 1, safety 2, safety differently, HOP, none of them are new. There's nothing new in any of them. It's just repackaged stuff that's been around a long time. And I think some of them are more dangerous than others. Some of them don't have any substance behind to say, practically, what does this mean, right? However, when it comes to this part of human factors, being human, etc., I think we need to look at that more and more to make sure that we're adapting to the new world, right? The new connected world where people are expressing themselves more, and we need to take that on board. We also need to realize that, people do make mistakes, and I think we all realize that. I mean, some people turn around and say, stop blaming the employee. Between us, I don't know a single company that goes around and say, that's your fault. I mean, maybe they exist, but most of the companies I talk to do not blame the employee first off, right? So I think people that are actually saying, stop blaming the employee, they should actually stop saying that, because it's not the truth, right? And most of the people that say that, no disrespect to anybody in the room, tend to have another interest by saying that. They want to create controversy, and then maybe you then find out that they're trying to sell something, right? But so I've gone off on a tangent there. So I think coming back to look into the future, I think that we need to improve what I call the coaching, the mentoring skills, the leadership skills, and the way that the health and safety professional adapts. I think that's where I would focus. Plus, more and more transfer as much as we can for the line management to take responsibility. again, going back to my dad said to me, Malcolm, and this was my advice for me when I first started work. He said, Malcolm, he said, you got to remember one thing. If it's important for your boss, it's important for you. Now, I didn't know I was going to work in health and safety, and I've applied that to the way we do health and safety in L'Oreal, because I think if the bosses talk about productivity, quality, and all the rest of the stuff, and not about somebody's safety, their health, their well-being, then we're sending messages. So part of what I'm trying to do, I see the future is expanding that and pushing that more and more into our organizations. And then finally, if I had a dream, it would be that more companies would jump on board with this approach of safe at work, safe at home, keeping kids safe, and actually export what we do outside into the local communities.